Tara ko yung ikuas mo pa-check up po sa kumata nganhi sa Celebrity Optical dinhi sa the hospital at Maayo.
And let's dive into some my opening facts like how often we should get our eyes checked ug nganong even 2020 atong vision dapat gyapon ta mo visit og optometrist. And unsa man gyud na ang photochromic and progressive lenses and what makes it special.
Hi, Doc. So, the one you're wearing now, is it still comfortable, or you think there's some changes already?
Comfortable bitaw siya, pero I think murag magpa-check ng yun ko. Would you suggest ba na kung magpa-check sa yun na yearly basis?
Yes, definitely. I would highly recommend to have your eyes checked regularly if possible. So it's either every 6 months or annually or once a year. You do the eye test because number one, it gives you an update as to the current condition of your vision. And then second, it's also good for early detection.
Basta na siya nga procedure daw?
Good question. This is what we call ophthalmoscopy. So with that, there's a device that we use. It's just like a handheld telescope. And then we look at the inside of your eye. And then by doing that, we will have an idea if the person is diabetic or hypertensive.
Would you advise also, even though clear ang mo vision or panaw na mo wala di problema, ang amo ang mata, would you suggest mo visit the optometrist in a regular basis?
Absolutely. Did you know that even if your rating is 20/20 when we check your visual acuity, it does not mean that your vision is entirely normal. As humans, we have a tendency to overfocus or overcompensate. So, bisan usahay na grado, makakita gyapon ta sa 2020 kay we have this autofocus mechanism sa atong vision, no? So, if something is blurry, in a millisecond, our eyes have the tendency to adjust munang mabasa nato ang line sa 2020. At the same time, pwede man sad siya nga 2020 or normal vision, but if the patient's work involves a lot of computer works, the patient may have computer vision syndrome as well. So, or probably dry eye syndrome as well. In order for us to manage that kind of condition, the patient has to visit their optometrist. I think it's now time to go to the refraction room.
Okay,
and let's
go.
get your eyes checked. Okay, so this glasses of Dr. Save, this is a progressive photochromic lens. So as you can see, the lens is still clear. Now we're gonna test it and put it under the UV lamp so that we will see how the lens will change from clear to dark, just like when you're exposed to the sun, and then the color will change. It will become sunglasses. So see, in just less than 5 seconds, you see changes already in the color of the lens. You're supposed to wait 1 minute, but this one, it only took us less than 30 seconds. With a photochromic lens, a progressive lens can be a photochromic lens. A single vision lens with anti-radiation can be a photochromic lens. The advantage of this one is it is a multi-purpose lens. While it can have a grade, like for you, it has a corrective grade, but at the same time, when you go outside, aesthetically, sunglasses na sad siya. So you won't have to all-in-one na ba?
So I really love photochromic lenses kay in my experience for the previous years nagyod with Doc Christine, ang ganahan dyan ng photochromic kay of course as she had mentioned, dili na kakinahanglan mag-ilis-ilis o glasses when you go out automatically. Kaya syempre kung gaay glasses nakakayang ba dito sa if ever you go to the beach, suwaw gyud kaayo. Sa sun sa usahay, suwaw gyud kaayo. Uy, kung laisyo na snow, suwaw sa kaayo. Di ba? But actually if ever you are wearing a photochromic glass or transition glasses, as in automatically shades na sa yun ay siya or sunglasses na din siya. So, wala effort din nakakinang magkuha pa og lain. And of course, clear di hapon tanan because it is graded.
Yeah. Again, this is a progressive lens. So when you say progressive lenses, Doc, it's a multifocal lens. When you say multifocal lens naman, multiple focus. So you can see at far, that's your driving grade. You can see at near, so this is your reading grade, and you can even see intermediate grade. The best thing about progressive lenses or the multifocal lenses is that it doesn't have the visible line.
Yes.
If you remember, back in the day, Mama, Papa nato, they used to wear glasses na naay
Kaya ito tawagon og double vista, right?
Exactly.
In other words, naghan siya og grades in one eyeglasses
Si
or one
doble
lens.
vista from the term doble to grades
grades lang.
far and near. But how about intermediate? That's the beauty of progressive lenses. All the grade that you need is already in one lens, plus no visible line, and then the progress of the grade from far to near is seamless.
So, kumutan ako glayo, ari kumutan aw.
Sa top part,
Top
yes.
part, then
If you look at near, like
Yeah.
anything within arm's length, you use the bottom part of the lens. That's why you have to move it closer like this.
Yes.
Now, for drugs, like you're a dentist, if your patient is somewhere like that, or arm's length, yeah.
So, kanila.
Usually, ang mga ngipon, yung naman So this is clear, right?
Yes, it
Correct?
is clear.
Yes. So that's the intermediate.
So, nice yung kay ko imong glasses, progressive na photochromic pa.
Yes, that's a perfect combination actually for patients who are 40 and above.
Salamat kayo sa pagkuyog na ko as I had my eyeglasses nga grabe ka perfect. Anong perfect siya? Progressive na and photochromic pa yun. So mao nang advice to visit your optometrist regularly kay dili lang yun matang ilahang ma-check kung dili sa pag-check sa mata ma-check sa nila kung naa ba kay systemic disease. So mo na ang gisulti ganin na Dr. Sid, visit your optometrist at least once a year. So again, this is Doc Save reminding you to eat in proper proportions, brush your teeth after eating, and just keep smiling. Bye-bye!